Hello viewers. Thyroxine is basically produced by the thyroid gland that is present in front of our neck in the form of two lobes, right and left, which are connected with the central lobe isthmus. The function of the thyroid gland is controlled by the TSH that comes from the anterior pituitary gland. If the problem is in the pituitary gland or in the thyroid gland, then overall thyroxine production can be impaired. The purpose is to produce a thyroxine, and thyroxine has multiple function in our body, but whenever there is a problem in production of the thyroxine, then we label it as the hypofunctioning of the thyroid gland, and the disease name is hypothyroidism. That can be the primary, means the problem is in the thyroid gland, or that can be the secondary, means the problem is in the pituitary gland. First, we have to make the diagnosis with the help of the thyroid function tests, which includes TSH, free T3 and free T4 levels. If TSH is disturbed, means increased in case of primary hypothyroidism, or decrease in the form of secondary hypothyroidism, then thyroxine production will be impaired, and we have to replace with synthetic thyroxine that is available in the market. Prescribing the thyroxine is not a problem, but the problem is how we can instruct the patient to take the thyroxine dose. The dose of the thyroxine is basically calculated by the weight of the patient, especially in the adult patients, and we have to be very careful while prescribing the thyroxine. In adult, young adult, healthy adult, in whom we are going to prescribe thyroxine, we calculate with the help of weight of the patient, and we have to multiply by the 1.6 microgram per kg per day. And we have to be very vigilant if we are prescribing the thyroxine to an elderly patient, or a patient having some sort of ischemic heart disease or arrhythmias, then we have to be very careful while prescribing the thyroxine, because thyroxine will disturb the cardiac rates. But if in case of children, we have to calculate the dose. Relatively higher dose is being prescribed to the children. First we have to calculate the dose, and then we have to give the instruction to the patient that always purchase the thyroxine from a medical store or pharmacy which has a controlled temperature, because thyroxine is very sensitive medicine, and if it is exposed to heat or sunlight, the efficacy of the thyroxine is disturbed. So we have to be very careful while purchasing the thyroxine, and we have to be very careful while transporting the thyroxine, because in heat, in summer, if we will carry the thyroxine openly, that will be exposed to heat and sunlight, it means the efficacy of the thyroxine will be abolished. And in whom we have to keep in a room that must be having a good temperature, or we have to keep it in the fridge, not in the freezer, and we have to wrap it in the shopper. And always take the thyroxine dose early in the morning, and empty stomach. That should be at least 1 hour gap between the intake of the thyroxine and the breakfast. And never take some medicines which impair the absorption of the thyroxine. And commonly medicines we usually ask the patient not to take with thyroxine are calcium, iron, PPI or antacids. And if someone cannot take the thyroxine early in the morning, then that patient can take the thyroxine at bedtime, but the gap between the dinner and the intake of the thyroxine should be at least 4 hours. And the main important thing is how to monitor the thyroxine, because patient is taking thyroxine, how we can decrease and increase the dose of the thyroxine, that can be calculated with the help of TSH that are usually advised to take in after 6 to 8 weeks. If thyroxine is being taken and TSH is in the reference stage, then we can continue with this medicine, because this medicine is usually taken throughout the life, and we can adjust the dose if needed, but with the help of TSH level and according to the symptoms of the patient. Thanks for watching, and don't live without LSCS.